There are few words in the horse world more frightening than the word colic. For many horse owners, it is the emergency they fear the most. One moment, everything seems normal. Your horse may appear slightly uncomfortable or quieter than usual, but nothing seems seriously wrong. Then suddenly, the situation escalates. The horse begins pawing, sweating, rolling, or throwing itself to the ground in pain. And within minutes, panic sets in. But among all forms of equine colic, there is one condition that veterinarians especially fear. It is called a strangulating lipoma, and it is one of the most dangerous abdominal emergencies a horse can experience. Now, new international research is helping veterinarians understand why some horses may be more vulnerable to this devastating condition than others. The findings could completely change how horse owners think about aging horses, obesity, metabolic disease, and even turnout management. Because according to this new study, strangulating lipoma colic may not be as random as people once believed. For years, veterinarians knew that older horses seemed more likely to develop strangulating lipomas, but nobody fully understood why. Many owners were told it was simply one of those unfortunate age-related conditions that could happen without warning. However, researchers are now uncovering possible links between strangulating lipomas and conditions like laminitis, equine metabolic syndrome, obesity, and changes in management practices. And if these connections are real, they could help horse owners reduce risk and recognize problems earlier. So today, we're going to break down what strangulating lipoma colic actually is, why it is so deadly, what this new research discovered, and why every owner of an aging horse should be paying close attention. First, let's talk about what a strangulating lipoma actually is. A lipoma is a fatty tumor in many animals. Lipomas are relatively harmless collections of fat cells. However, in horses, some lipomas form inside the abdomen and attach themselves to the intestines with a long stalk of tissue. Over time, these fatty masses can swing freely inside the horse's abdomen. Eventually, the lipoma may wrap itself around part of the intestine, like a tightening rope. When this happens, the blood supply to the intestine becomes cut off. Without blood flow, the intestine begins to die. At that point, the horse develops what veterinarians call a strangulating obstruction, which is one of the most severe forms of surgical colic in equine medicine. Without emergency surgery, survival is extremely unlikely. This is why veterinarians take strangulating lipomas so seriously. This is not a mild stomach ache or a simple gas colic. This is a rapidly progressing medical emergency where time becomes critically important. What makes the condition especially frightening is that these lipomas can develop silently over many years. A horse may appear perfectly healthy while these fatty tumors slowly grow inside the abdomen. Then, one day, suddenly, the intestine becomes trapped, and everything changes within hours. The new study, conducted by researchers from Colorado State University, the University of Florida, and 3 counties equine hospital in the United Kingdom, examined confirmed cases of strangulating lipoma colic. The new study, conducted by researchers from Colorado State University, the University of Florida, and 3 counties equine hospital in the United Kingdom, examined confirmed cases of strangulating lipoma colic between 2022 and 2024. Researchers compared effective horses with healthy horses and looked at factors like age, breed, medical history, management practices, endocrine disease, and housing changes. Several important patterns begin to emerge. The first major finding involved age. The researchers confirmed that the risk of strangulating lipoma colic increases significantly as horses get older. In fact, the study suggested that the odds increase by roughly 15% with every additional year of age. That is an enormous increase. It also helps explain why veterinarians most commonly see this condition in senior horses rather than younger animals. Researchers noted that horses under 8 years old rarely develop strangulating lipomas. The tumors simply take time to grow. This creates an important reality for modern horse ownership. Today's horses are living longer than ever before. Veterinary care has improved dramatically. Nutrition is better, and owners are able to keep horses healthy well into their 20s and even 30s. But as horses live longer, age-related disease naturally becomes more common, and strangulating lipoma colic appears to be one of those diseases. One of the most surprising discoveries in the study involved laminitis. Researchers found that horses with a previous history of laminitis had dramatically increased odds of developing strangulating lipoma colic. This finding shocked many veterinarians because the connection between hoof disease and abdominal tumors was not previously well understood. However, when researchers looked deep, the possible explanation began to make sense. Laminitis is often associated with insulin dysregulation and equine metabolic syndrome, commonly called EMS. Equine metabolic syndrome is a disorder involving obesity, insulin resistance, and abnormal fat storage. Researchers now suspect that horses prone to abnormal fat accumulation externally may also be more likely to develop fat-based tumors internally. In other words, the same horse that easily develops a crusty neck, fat pads, or obesity may also be more vulnerable to developing dangerous abdominal lipomas. This is incredibly important because it suggests strangulating lipoma colic may be connected to long-term metabolic health rather than simple bad luck. That changes the entire conversation. Because if metabolic disease contributes to lipoma formation, then prevention may actually be possible in some cases. The study also found that management strategies focused on maintaining healthy body weight and controlling metabolic disease appeared to reduce risk. This does not mean that every overweight horse will develop a strangulating lipoma. It also does not mean weight management guarantees prevention. But it does suggest that obesity and metabolic dysfunction may play a larger role than previously believed. And honestly, this raises uncomfortable questions for the horse world because obesity in horses has become extremely normalized. Many overweight horses are described as well-loved or easy keepers. But veterinarians have warned for years that excess fat is not harmless. Obesity increases the risk of laminitis, insulin resistance, inflammation, and now potentially one of the deadliest forms of colic. That should get everyone's attention. The study also identified certain breeds that appeared more vulnerable. Ponies, Welsh cobs, quarter horses, paint horses, Arabians, and Appaloosas were among the breeds associated with increased risk. Many of these breeds are known for being easy keepers and for having higher rates of equine metabolic syndrome. Again, researchers suspect the metabolic connection may be extremely important. Another fascinating finding involves stabling. Researchers discovered that horses experiencing increased stall confinement in the previous month had higher risk of strangulating lipoma colic. Why would this matter? Because the equine digestive system depends heavily on movement. Horses evolved to walk and graze almost constantly throughout the day. Continuous movement helps maintain healthy intestinal motility. When horses suddenly spend more time confined in stalls, intestinal movement may slow down. Researchers believe this altered intestinal motion could increase the likelihood of the intestine becoming trapped around a lipoma. This finding is especially important for owners of older horses because senior horses often experience change in turnout schedules due to arthritis, injury, weather, or management concerns. But sudden increases in confinement may carry risks owners do not fully appreciate. One of the most heartbreaking aspects of strangulating lipoma is how quickly owners are forced into difficult decisions. Equine colic surgery is expensive, emotionally exhausting, and time-sensitive. Older horses may already have other health conditions, and owners often have only minutes to decide whether surgery is possible. The emotional pressure can be overwhelming. This is why prevention and early recognition are so important. Researchers emphasize that understanding these risk factors could help veterinarians recognize cases sooner and potentially improve outcomes through earlier surgical intervention. Because with strangulating lipomas, every minute matters. The longer the intestine loses blood supply, the lower the chance of survival becomes. So what should horse owners take away from this research? First, Older horses deserve proactive metabolic monitoring, especially horses that are easy keepers or have a history of laminitis. Second, weight management matters for long-term health and survival. Maintaining a healthy body condition is not about appearance. It is about protecting horses from serious metabolic disease. Third, owners should be cautious about sudden management changes involving turnout and confinement. And finally, severe colic signs in older horses should always be treated as emergencies. Because strangulating lipoma colic progresses rapidly and waiting too long can be fatal. What makes this study so important is it offers something horse owners desperately need: possibility. For years, strangulating lipomas almost felt completely unpredictable. But now researchers are beginning to uncover patterns connected to age, obesity, endocrine disease, and management practices. And while there are still many unanswered questions, this research suggests that some cases may actually be preventable. That is a major development in equine medicine, because sometimes the most dangerous diseases are the ones developing silently for years before anyone notices. And sometimes prevention begins long before the emergency itself. If you have an older horse, have you ever dealt with colic, laminitis, or equine metabolic syndrome? And remember, I am not AI. If you listen closely, you can hear me breathing.